The muscles work together to provide the movement of synergy. This is when two or more objects align to produce a result. So a synergist is the muscle that is responsible for stabilizing the joint to avoid rotation and help the prime mover to add force and create the movement. In the previous examples of the chest pass and badminton smash, the synergist muscle would be the brachioradialis and brachialis, which stabilize the elbow joint and assist the bicep to allow the athlete to execute the pass and shot effectively without over-rotation and causing injury. The last type is the fixator. These are similar to the synergist because they stabilize the origin of the agonist and the joint where the movement occurs, but they immobilize the bone to stop unwanted movements like rotation, which could cause injury. For example, in a bicep curl, the biceps allow flexion, but as they are attached proximally at the scapula and distally to the radius in two places, when the contraction occurs, both of these bones will be pulled together. The fixator's role is to not allow the scapula to move, which could cause injury. Another example is the muscles of the rotator cuff, which are suprasupinatus, infrasupinatus, teres minor and subscapularis that attach at the shoulder girdle, which contract as fixators so the deltoid can provide movement at the shoulder. And to stabilize the head of the humerus in the glenoid cavity, for example in javelin, when the athlete is releasing the javelin, it helps to keep the arm stable so the javelin can travel in an accurate direction. Muscles have at least one origin and insertion. This is because when a muscle contracts, the origin is the attachment site at the stationary end of the bone and is proximal to the insertion. This is where it originates from and connects to the insertion. The insertion attaches to the mobile end of the muscle, which is known as the distal end, and pulls on the bone to move the lower appendage. Here we have the example of the biceps and the gastrocnemius. When the biceps are contracting, the insertion will move closer to the muscle, which will shorten it. And the same in the gastrocnemius. When the gastrocnemius contracts, the ankle will cause plantar flexion. So, muscles work together in pairs in order to create movement. These are known as antagonistic pairs, which we briefly spoke about before. Here are some examples of antagonistic pairs that work together to provide movement. So in terms of antagonistic pairs, one of the muscles, let's say for example the tibialis anterior is the agonist and the gastrocnemius is the antagonist. The tibialis anterior will be the muscle that is contracting in order to cause dorsiflexion at the ankle, while the gastrocnemius is the antagonist. But when the gastrocnemius is the agonist and the tibialis anterior is the antagonist, the gastrocnemius will cause plantar flexion at the ankle. So the roles can be reversed depending on the movement trying to be achieved. Here are two diagrams that show the anterior muscles of the body and the posterior muscles of the body, to name a few that we should know. On these next few slides, we are going to look in detail at the different joints of the body. So first we have the glenohumeral joint, which is inevitably the shoulder joint. This joint is a ball and socket, so they can perform a large range of movements. The ligaments help to keep it stable, and the muscles help to improve the stability of the shoulder to hold the humerus in the glenoid cavity to reduce the risk of injuries of dislocations. Examples of athletes are throwers. These are very susceptible to dislocations because of the explosive movements that are required in the execution phases of the throws, because the force acting downwards and repetition strains the ligaments. So the muscles of the rotator cuff aim to stabilize and control the arm after the release so it doesn't move out of axis, and the force of gravity causes it to fall too quickly. This is relevant in javelin. In the preparation phase, the arm is in flexion, so the javelin can feel power in order to be thrown by the athlete. In the execution phase, the arm moves to extension, so in order to release it with power. Next we have the radio-ulnar joint, elbow and knee joint. So the radio-ulnar joint is responsible for the supination and pronation movement. This is relevant in table tennis. During a forehand, the radio-ulnar will be supinated to allow the athlete to hit the ball repeatedly. And during a backhand, the radio-ulnar will be experiencing pronation. The origin of the radio-ulnar is the lateral epicondyle of the humerus and supinated crest. This stays stationary to stabilize the joint, while the lateral surface of the proximal radius and mid-lateral of the radius pull on the bone in order to create this movement. Also, the knee joint is a hinge joint which only allows flexion and extension. When preparing to kick a ball in football, the athlete in the preparation phase will be flexing the leg at the knee. The hamstring group is responsible for this action in order to contract the leg, while the quadriceps are relaxing. The origin of the ischium and the femur allow this action to happen by keeping the femur stable, and the tibia and fibula are moved by the muscle. When the athlete is in the execution phase that's kicking the ball, the quadriceps are contracting to straighten the leg while the hamstrings are relaxing. The femur and the ilium are keeping the bone stationary while the tibia is being moved by this action. The hip joint is also a ball and socket joint, which means it is susceptible to moving out of axis because of the range of movement that it allows. And same as the ankle, which is the same as the knee, as a hinge joint, it only allows flexion and extension movement. In trampolining, when performing a pike position, we would be experiencing dorsiflexion. This happens because the tibialis anterior is contracting the muscle at the knee in order to flex the foot. The origin is the tibia, which doesn't move and can remain stable, while the tarsals and metatarsals contract backwards towards the shin bone. In plantar flexion, when we are extending our foot back to land on the trampoline, our gastrocnemius is the muscle that is contracting, while the tibialis anterior is the antagonist, while the femur and the tibia remain stable and the calcaneus is inevitably moving the foot downwards. The spine is also a very important joint in the human body, as it essentially holds our framework and protects the spinal cord to allow the electrical signals to travel from the brain to the required parts of the body. Because the bones of the vertebrae are fibrous, it means no movements occur here, so we need the attachment of muscles to allow a small range of movement and to offer support when this occurs. The muscles of the trunk help to stabilize the joint, the same as the shoulder, to support the spine in complex sports. For example, in gymnastics, the gymnast performing a tumbling routine consisting of somersaults and balances will require the spine to stay supported in order to cope with the changes in position and being flexible to allow some movement to bend and extend. The muscles of the core, the transverse abdominis, would be contracting to allow the correct posture to be maintained, and the trapezius of the back would allow this anatomical position to be maintained. The ribs would be the origin of the rectus abdominis, which will keep it stable so that it doesn't move out of axis, while the sternum and the ilium move with the flexion of the spine. In terms of extension, when coming out of a hard, complex move like a back handspring, the erector spinae will be the agonist, while the rectus abdominis form the antagonistic action, where the sacrum, ilium, and vertebrae will be keeping the spine stable, and the ribs and the vertebrae and base of the skull will be able to move due to the movement. In our bodies, we have different muscle fibers. Some of us have more than one type in order to allow our bodies to work at different speeds. This is mainly a result of genetics in which fibers we are made up of, but through training it is possible to change the numbers so we can have equal amounts or more of one other type than others, depending on the sports we participate in. The three types are categorized below based upon their contractile and metabolic properties. So slow oxidative muscle fibers already tells us that they are slow at producing force. This we could interpret as that they require oxygen in order to work. So they're more likely used for aerobic activities in order to stay for the long durations. Secondly, we have fast oxidative glycolytic fibers. These fibers can be used in both aerobic and anaerobic activities because they can work with or without oxygen. So in terms of longer distance sprints such as the 400 meters and the 800 meters would be more appropriate in the legs especially, so they can work. Also, we have fast glycolytic muscle fibers. These are mainly suited for anaerobic activities that are explosive, so they can produce a large amount of force in a short space of time. This slide shows that the lower the intensity of exercise, the more slow oxidative muscle fibers a person will have. This is because they need to create a resistance to not fatigue when trying to complete long distance exercises. But as intensity increases, more fast oxidative glycolytic and fast glycolytic fibers are recruited to cope with the demands and to cope without the use of oxygen. Now we are going to look at the different types of muscle fibers in more detail and how they are structured differently. Slow twitch and fast oxidative glycolytic fibers are similar in colour as they are red because they contain large numbers of mitochondria in order to produce ATP for respiration, so the muscles can contract in aerobic exercise. However, slow oxidative fibers are much darker in colour. This is because they contain large numbers of hemoglobin, because they carry a large blood flow and they have the most myoglobin, which binds to oxygen. This is why they are most appropriate fibre for aerobic activities, for example marathon runners, and mainly endurance or submaximal activities that use these fibres in order to sustain their performance over long periods of time. In contrast, fast glycolytic fibres are much lighter than the other fibres and are practically white. This is because these fibres do not require oxygen to make energy, because they function anaerobically, which is without oxygen. This is the reason they have low numbers of mitochondria and capillaries, which is why they can only function for a short duration before fatiguing, because their structure makes them less resistant due to having such a large force and fast speed of contraction. It makes them fatigue very quickly. So anaerobic sports like sprinters, jumps or throws, known as maximal activities, rely on these fibres to produce the maximum amount of force in short durations.